this ready. Good morning, everyone. Thank you for joining me today for an update on our work to refocus Alberta's healthcare system, as well as some very exciting investments being made in emergency health services through Budget 2025. In November of 2023, Alberta's government began refocusing the healthcare system to provide better care to Albertans, regardless of where they live. Since then, significant progress has been made, and we now have 2 provincial health agencies that are fully operational: Recovery Alberta and Primary Care Alberta. In just a few weeks, on April 1st, Acute Care Alberta will join them in becoming fully operational, and Assisted Living Alberta will become a legal entity. In the refocused health system, Alberta Health Services will transition to becoming a service provider. And alongside Covenant Health and other providers, AHS will operate hospitals and acute care services. We want to support AHS to be successful in this transition and have the space to focus on providing excellent acute care. That is why we are shifting a key area of healthcare from AHS to Acute Care Alberta. So later this spring, emergency health services will come under the purview of Acute Care Alberta. And as we all know, EMS, or Emergency Medical Services, are the backbone of our healthcare system. Whether it's responding to an accident or a medical emergency in our homes, paramedics are often the first line of care and treatment. So these changes will allow emergency health services to focus on improving efficiency, patient safety, and response times in all parts of the province, while also being responsible for meeting performance targets and its own workforce development and well-being. We have also promised that refocusing the healthcare system will provide Albertans with a seamless experience in their healthcare journeys. To that end, we are creating a shared services entity that will handle IT services for Alberta's healthcare system so that patients' healthcare information stays with them throughout, as well as healthcare workers having the information they need to provide the best care possible. The shared services entity will also provide centralized corporate and support services such as human resources and centralized communication functions for each of the 4 provincial health agencies. Not only will these shifts enable and support high-quality health care in Alberta, but a centralized and efficient shared services model will also ensure minimal expenditures in healthcare overhead, and that a maximized investment is made towards frontline health services for Albertans. There is no question that a high-functioning healthcare system needs the skilled expertise of emergency healthcare workers, and in turn, they need state-of-the-art equipment to help them save lives, such as upgraded vehicles and equipment. That's why I am so pleased to announce that, if passed, Budget 2025 will include an additional $40 million towards a total investment of $60 million over the next 3 years for the EMS Vehicle Capital Program. This funding will go directly to replacing older vehicles and upgrading our current EMS fleet, ensuring paramedics across Alberta have the best resources to provide the care that Albertans need. This is an investment in reliable, timely, and efficient care for Albertans, no matter where they live. It's an investment in our paramedics, the dedicated caregivers on the front lines, and it's an investment in the long-term sustainability of Alberta's healthcare system. We know that when someone's life is on the line, every second counts. The speed of response can make all the difference between life and death, or between a quick recovery and long-term complications. By ensuring that we have modern, well-maintained EMS vehicles, we are investing in our paramedics and the work that they do. This investment is especially important for our rural and remote communities, where longer travel times and distances have posed challenges. With upgraded vehicles and equipment, we will strengthen our EMS fleet to ensure that paramedics are well equipped with high-performing vehicles that can handle the demands of their work. An updated EMS fleet also has significant benefits for the broader healthcare system. Right now, our emergency departments, urgent care centres, and hospitals are under tremendous strain. By strengthening the EMS system, we reduce the strain on our hospitals. Fewer delays in transportations also means patients are getting to the right care faster. As our population grows and ages, demand on emergency services is only going to increase. This investment ensures that we are ready to meet those future challenges. Thank you to the incredible professionals in EMS who work every day to keep our communities safe and healthy. And we are committed to ensuring that you have the resources and your fellow healthcare workers have everything that they need to continue providing exceptional care in Alberta. And again, I just want to give a huge shout out to our paramedics and the whole healthcare team, the front and first responders. They do such an amazing job each and every day. And right now I'm going to call on Marty Scott, who is the Executive Director, EMS Provincial Program, AHS, to speak. Thank you.
Thank you, Minister. Okay. First, I'd like to welcome you all to Northwest Station in Edmonton. It's our headquarters station in the city, for those of you who are here in person and virtually. Whenever possible, we like to take opportunity to recognize and thank the many people that work in the EMS system in Alberta. There are many roles in this system, from frontline paramedics and emergency communications officers to significantly important supporting roles such as clinical educators, quality patient safety experts, and fleet management professionals. This morning, those of you in person may see our support team at work, cleaning, restocking, and preparing ambulances here for paramedics on their next shift. The delivery of EMS is truly a team-based service, and without the care and commitment of many people, our frontline paramedics and emergency communications officers would not be able to do the great work that they do. I'm pleased to be here today in support of the announcement of additional funding for the EMS Capital Equipment Program. AHS has a fleet of 600 ambulances and 98 support units, and last year this fleet traveled over 28 million kilometers in the provision of service, and that's an increase of 1 million kilometers over last year. The continual increase in utilization places significant demand on our fleet professionals and our maintenance agencies to ensure ambulances are appropriately maintained without reducing vehicles that are needed for frontline service. The capital funding announced today will position our team to continue to ensure paramedics have reliable vehicles and equipment to deliver care through a current fleet of ambulances and by removing older vehicles from service. There is significant demand for vehicle chassis and end-stage ambulance manufacturing in Canada. Long-term funding enables us to engage ambulance suppliers early with confidence to make commitments on vehicles as supplies continue to be strained. This funding also includes new medical equipment and technology required to deploy ambulances into the system. This equipment includes new cardiac monitors, power stretchers, power loading systems, as well as other related equipment to help support paramedics in their delivery of care. The funding includes new radio and computer equipment that enables our emergency communications officers to track the location of every ambulance in the province and send the closest, most appropriate resource. In the coming weeks, we'll work internally at AHS to determine what vehicles will be ordered and where they'll be located. I'd like to again thank the Minister for her support of the EMS Capital Equipment Program and to the Government of Alberta for the financial capability to ensure we are positioned to support the delivery of this vital service.
Thank you, everyone. We'll open it up to questions from the media. As always, if you could please state your name and outlet, and we will be sticking to one question and one follow-up today. We'll start here in the room before moving to the phones. Go ahead.
Hi there, Lisa with Global Edmonton. What's being done or what money's being put into staffing specifically? Because the number one issue that I'm hearing, especially from paramedics, is that they're so short-staffed that even, you might have a brand new vehicle, but they're dropping off patients at the hospital and they can't even wait for them. They're just dumping them off because they have to get to another scene. Wait times are extreme when they're at a critical scene. So it sounds like staffing is a big issue compared to just, new equipment and vehicles.
Well, we're looking at all of that. In Budget 2025, there has been an increase to staffing. I don't have the number right in front of me, and Jesse can follow up with you on the exact number. But besides staffing, we want to make sure that we also are making sure our ambulances go to to the scenes that are most required. So when we have less urgent calls, we're making sure that the ambulances that are going have the right acuity to handle with that. Perhaps I could turn it over to Marty, because I know there was a number of areas we were trying to make sure that supports are available for our paramedics when we look at the interfacility transfers, the non-urgent transfers, that we're using the right equipment, the right staffing at the right times. So, Marty, is there anything you'd add to that, or Anne? Go ahead. Please introduce yourself.
Hi, I'm Anne McDonald. I'm the Acting Senior Program Officer for EMS. We've made a bunch of changes within our staffing model. So we've recently changed how we're hiring staff. So we brought into a one-point contact where we're actually bringing people all in the same place, finding the right place to bring them in, and trying to reduce our need for casual employees. So we're really trying to hire in that full-time position so that we can have a sustained staffing model instead of looking at our casuals as the reliability that we need. We've also done some work on focusing our wait times, all those pieces. We're trying to reduce that by going to the 45-minute return to service work. So we've put in place processes on how we offload patients. We've put in place processes on how we get back into service. And we're doing the really important things to look after our staff. So how do we give our staff breaks, making sure that they have downtime so they can be humans, as well as looking after our patients, because we know that's really important to keep our people happy and keep them coming to work.
My follow-up would be, on that note, what is causing these issues then? Because I'm hearing very different things. Like, prime example, a couple days ago, there was an ambulance from from Spruce Grove called to Sherwood Park because that was the closest one that was available. And I know that you spoke about, some ambulances are only called to not critical scenes, but firefighters are only called to extreme critical scenes. And I'm hearing from firefighters that they're waiting for the ambulance to arrive, and every minute counts when it's a scene like that. So what is the issue here? Is it short staffing? Is it miscommunication? Because it doesn't seem like it's, not having enough vehicles.
Well, and as you heard Marty indicate earlier, they're actually going to more calls. When you look at the number of calls are increasing, we have more people in Alberta. We are also, I'm expecting very shortly here by the end of March, the report that has been done on looking at all of our EMS across the province and making recommendations. There was a previous report. This builds on that report. So we're looking at, okay, what currently exists, where are the gaps, and how can we fill those gaps? So there's a number of things as has already been mentioned, but we know that more has to be done, because as we continue to grow as a province, there's going to be more demand. We also have to make sure that we don't bring in the resources into our cities and then leave our rural communities without the facilities and the resources that they need. They need an ambulance in their communities as well. So there's all of these areas. We're looking to make sure that we do respond to the recommendations from the APEC committee, which is a committee of the paramedics and providers of EMS services that have been reviewing these things. I'm not sure if either of you would like to comment further. Anne, is there anything further?
So one of the pieces with our, you mentioned Spruce Grove. So one of the pieces of our system is that we can move our resources around the province based on need. And so that event, for example, they didn't come from Spruce Grove. They were actually closer to Sherwood Park, which is why they were the closest ambulance. So the system really does ebb and flow as the calls come in. We are working really hard to make sure that our rural resources are staying in the community as much as possible, which is part of the 45-minute return to service. We do really focus on the people aspect. So how do we keep people in their community? By doing the return to service, by keeping the lower acuity events, responding to them differently, we actually have the ability to keep more resources in the rural community. So we will see good response to that piece. The other piece with our new resource, or with the resources coming in, it allows us to put the resources in the right place.
Okay, thanks everyone. I'll do one more call in the room.
Dave Dave Mitchell, CTV. You mentioned rural communities, Minister, and former UCP MLA Scott Sinclair, who stepped down. He had a lot of concerns about rural communities. Went so far as to say the system has hit rock bottom. What's your response to that comment, first off, and did you support his removal from the party, and why?
Well, I know that Scott has always been a strong advocate for his community, and I know that rural healthcare in general has a issue in terms of not just attracting and retaining healthcare professionals, but also making sure that we have the right resources in the right spots. So there are many things that we are doing, including the rural health strategy. It's been a prime focus of mine to make sure that we improve services right across the province. It's also part of the reason that we're refocusing the overall healthcare system. Now I know that in Scott's community, there's actually, it's slated to receive a new ambulance, EMS ambulance facility. I would say that we're going to continue to prioritize healthcare in rural communities. It's the reason why the primary care compensation model for new physicians that will help attract and retain doctors for local communities. It is the reason why we, as I said earlier, the rural health strategy, it's the reason why we're investing in rural health communities. How can we revitalize those smaller rural hospitals and give them new purpose to attract and retain healthcare professionals? So we've got a large number of strategies that are in place, and we're going to continue to work on improvements. We've seen some improvements, but they haven't gone far enough, so I'll say that more to come.
When he says rock bottom, do you support the fact that his removal after comments like that is justified?
I would say that there's been a strain, definitely, but we see hotspots across the province at all the time. And particularly right now, even in our urban centers, we're seeing, because we're in respiratory, a slight bump up in respiratory virus season. So we continue to see hotspots. We need to address it right across the province. And every community deserves to have excellent health care. That's been my focus from the beginning, and that's what I'm going to keep striving for, to make sure that we have excellent health care in every part of the province.
Last week, last question, the Premier mentioned a third party helping send those Turkish medicines to Ukraine. Can you broaden who this third party is and why are they involved anyways? And do you feel comfortable sending these drugs that aren't good enough for Alberta to Ukraine?
Well, and I need to clarify that the drugs in question are, in fact, good quality drugs. The supplier of these drugs, the manufacturer of these drugs, Atabay, actually supplies acetaminophen for most of Europe, Northern Africa, and the Middle East as well. So these are good quality drugs. They would not have been allowed to come into Alberta by Health Canada were they not good quality drugs. So first, to correct that misinformation. Second, since I came into office, I have had concerns about these good quality drugs sitting on a shelf and not wanting to see them expire. If we can't use them in Alberta, then we should be sending them to other countries, particularly war-torn countries that have a lack of medication for their people, and that's what we've been exploring. So more to come as we finalize details.
Thank you.
Thank you.
Hi, Minister. Julie Wong, CBC News. You talk about how these children's medications are quality drugs, but AHS banned their use in neonatal units because of possible risks to patients. So we're talking about how because the drugs were more viscous, they were clogging up feeding tubes. So why would the Alberta government willingly put that risk onto patients in Ukraine?
So my understanding is that for under the age of 2, that these medications are administered through lines, through intravenous lines. My understanding is that our lines are smaller than what is used in Europe and in other countries where these products are being used, and that these are perfectly safe. They're recommended for over the age of 2, and so for under the age of 2, in an abundance of caution, AHS did not recommend using them. They can be used safely if they are administered properly.
And just switching gears a little bit, RCMP are now investigating the allegations into AHS. What does this indicate to you about the level of seriousness of possible government interference into these matters?
Well, I'm not aware of who the RCMP are investigating, but I only found out about the investigation through media, such as yourself. That being said, our government is willing to cooperate with the RCMP in any way possible, and I will continue to make sure that we do everything we can to facilitate that for them. And this being an ongoing investigation, I won't be able to comment further on it.
Thank you, everyone. We're going to move to the phones. Operator, can you put through our first caller, please?
First question from Catherine Gripowski at Alberta Today. Please go ahead.
Hi, thanks for taking my question. So I'm hoping you can clarify on this capital spend. Does that include the inter-facility transport vehicles, and will these all be going to the public EMS system, or is there any plan for contractors or private ambulance to get these vehicles?
Well, the EMS, the capital infrastructure is all integrated infrastructure through the oversight of the acute care agency, Acute Care Alberta. EMS or emergency health services will function under that oversight. Now, this is additional capital infrastructure, capital ambulances, replacements, etc., for our current, not for the independents. That is something that they would be looking after themselves. This is additional. The inter-facility transfer dollars that we had allocated, I want to say almost a year ago now, that we had made the announcement here almost a year ago, that's separate funding. So this is specific capital funding for ambulances. Anything you'd like to add?
Maybe just a little bit.
Sure.
Yeah. Thank you for the question. Thank you, Minister. Just maybe to clarify, the way our funding works with our service providers is they're funded, their fleet replacements are funded as part of their ongoing annual contract value or their monthly payment. So just wanted to clarify that's how their funding does flow to them. So, and that's true for our inter-facility transfer providers under contract, the ones that we announced last year. It's included in their funding. This is specific to AHS, so our funding flows a little bit differently because we're an internal agency. So, thank you.
Did you have a follow-up, Catherine?
Yeah, I do. So on these changes to the shared services entity for IT, it seems to me that AHS had that for all areas of the IT system. So can you explain what's changing, why you need to set up this separate entity?
Well, this entity actually will now provide services to all of the 4 agencies, not just Alberta Health Services. So it's not just going to be to the acute care agency. It also will now transcend over to Recovery Alberta, as well as Primary Care Alberta, as well as Assisted Living Alberta. So in fact, it's expanding the reach of shared services so that more agencies and more entities can utilize it.
Thank you. Operator, can you put through our next caller, please?
Next question from Jack Starrow at Canadian Press. Please go ahead.
Hi, Minister. Also have a question about the RCMP investigation. I'm just going to shove this as a two-part one because I know the answer to the first one. So I know you haven't been interviewed by the RCMP related to this. And then the main question, with our 2, new surgical facilities planned for Red Deer and Lethbridge, are those facilities going to still be on hold until, after this RCMP investigation is done, which could take who knows how long?
Well, I can't speak to the RCMP investigation. They're doing what they need to do. As far as chartered surgical facilities, particularly the one in Red Deer and in Lethbridge, because it is part of the ongoing investigation, the third-party investigation, as well as the Auditor General investigation, those contracts that were being negotiated are paused. So until we get further clarity, those are paused, and we'll have more to say as that progresses.
And my follow-up question, I'm curious for your thoughts on you know, the RCMP investigation is a big step, and I guess I'm wondering if you think, you know, the ethics changes that were made a couple of years ago for ministers and politicians to receive higher value gifts might have played a role in getting to this point now where we have, I think by my count, it's 6 separate investigations into allegations that kind of stem from, you know, in the public's mind, the gifts of Skybox hockey.
So I think there's a lot of things being conflated there. I go back to the fact that the Auditor General is investigating AHS procurement practices. And also I would point to the third-party investigation that's going to be done by the retired judge that is starting very shortly, again looking at procurement processes. And so I would just say let those investigations go through. We in government, as well as every Albertan, has an interest in finding out what is going on and making sure that we have full transparency in our procurement processes and not conflating issues.
Thanks, Minister. Operator, can you put through our next caller, please?
We have no further questions on the line.
Okay, we're going to end it there today. Thanks, everyone.
Thank you.